Distal radius fractures and the surgery that's required can be very debilitating and can cause a lot of different types of struggles. Now, I know that most surgeons, most hand surgeons might think, oh, this is relatively easy. And most therapists might also think the same. Oh, I see distal radius fractures all the time. But if you're here, it might be because you're facing more of a struggle than others. If that's you, if you've suffered a distal radius fracture and it seems to be taking longer than usual, or you just have a lot of questions and concerns. My name is Huang. I'm an occupational therapist and certified hand therapist. And today I'm going to cover some of the three biggest problems after a distal radius fracture, and especially after a fracture that has had surgery. Now, not all injuries are created the same. Some people, when you fall and you put pressure through your hand to catch yourself, and it could happen in so many different ways. I've seen it people falling, I've seen people in different, like car accidents, that have had distal radius fractures, wrist fractures, right here to this bone, and the impact that it has to the whole arm. So it's not just here, this part might break, but it makes an impact to your elbow and to your shoulders, right? And majority of the time, you break one bone. It's this part right here, and it might shatter into several different pieces. And the doctors come in, they put plates and screws, put all those pieces together. Sometimes people will break this bone right here and have different types of surgeries. Most of the time, they're left alone. You don't even have to do surgery. But wrist fractures can be really complex. Today, I'm going to just address some of the three problems that you want to avoid after. If you're suffering from a distal radius fracture, let me share with you what I share with my patients here at my clinic. One of the biggest problems that happens after a distal radius is called a trigger finger, right? So what happens is we have tendons that come through. Um, they start in our elbow and they cross the wrist and come and um, connect in our fingers. They attach in our fingers, and they're the ones that allow our fingers to move. And what's the biggest thing that people tell you after a fracture, after a surgery, is to just put a ball in there and make a fist. Well, what happens after, it's one of the most common problems I see, is that you can develop what's called a trigger finger. So your tendon gets like this inflammation at a very particular spot. And we have a pulley system. It's a pulley and it holds our tendons down. And when your tendon becomes irritated and inflames right there, it feels like a ball, a knot. And every single time you make a fist, that knot pulls through, goes down through that pulley system. And then when you open your finger, it catches and it gets stuck. And then you have to pop it out. And every single time you do it, it irritates. It is one of the biggest problems after a distal radius fracture. If you've had surgery, if you've been wearing a splint, if your doctor decided they wanted to put you in a cast, even after the surgery, and it sits there and it rubs right there, you could develop a trigger finger. So one of the biggest things is to not constantly work in the middle, right? That makes that problem worse. Talk to your therapist about what you're allowed to do. One of the biggest things that I teach my patients is that you can easily put your fingers through here, right? Clasp your fingers. So take your other hand, put it through, and stretch these ligaments out. These are bones. These are your metacarpal bones. We have 5 of them, right? One for your thumb. But we have little muscles in between. And what happens after distal radius is those muscles get really, really tight as you're trying to move and work your fingers. So you start squeezing them together, and these muscles get really tight. This one exercise of just clasping your fingers in between can stretch those ligaments, stretch the heads of these bones apart, and give those muscles a little bit of room to breathe and to move. and reduce your risk of developing what's called a trigger finger. There's so many different things that you could do. I just want to share one of those things. But talk to your therapist about how to avoid developing a trigger finger problem after a wrist fracture. All right. That's number one problem. The second most common problem after a wrist fracture is what's called a stiff hand. So if you break your wrist right here, this part might not be allowed to move for a while, but your fingers and your thumb, though it might feel like it hurts, or if you've had surgery, it might feel like it's pulling through the scar. Technically speaking, you're allowed to move your fingers. And if you don't move your fingers right away, if you have a cast that's too high, this is your distal palmar crease. When you bend your big knuckle, that crease there, it's supposed to, you have that crease because that's where you're supposed to bend, right? If your splint comes too high, and it stops you from moving all the way. If your splint comes too high, if your cast comes too high, or if you just generally got really stiff right afterwards, you can develop what's called a stiff hand. And that means that when your hand stops and your fingers stop moving, all the tendons get really rigid, all the ligaments get really rigid, and all like the joints, they get really, really rigid. That's when a stiff hand um, develops. And stiff hands are one of the hardest things to treat and get rid of. They become very painful. They become very, they're just a challenge, you know. Then it becomes like very repetitive, trying to treat a problem that you didn't have because you broke your wrist, right? You broke your wrist. You didn't do anything to your hand. So one of the things that I really encourage is learn how to fully exercise your fingers well, so that you don't develop a stiff hand. And one of the things that I like to work on, this is still my favorite exercise, you just try it, is to put your fingers in between. The little muscles that are inside your hand actually come up and attach themselves into this middle knuckle. And I don't care what part of your finger or hands you hurt, these middle knuckles, right? These are our middle knuckles. They're called your PIPs, right? They are the troublemakers of your hand. So no matter what happens to your hand, that's the troublemaker. And what happens is when they get really stiff, the whole hand stops working as well. And so one of the things that you want to do is you want to make sure that they go straight. So a lot of times people are working to make a fist. I like to teach my patients to straighten out their fingers and stretch them straight. Because if you can stretch them straight and they go straight, you can actually make a fist even better, right? Even better with less pain. So one of the things I like to do, again, this is my favorite exercise, is to clasp your fingers in between. If you can't get them in between, you can start a little bit at a time. They might be so tight you need some help, but you can at least start here and then work your way down. And you can start with the tips of your fingers if you need, and then work to getting your whole hand. If you can't get your fingers through, that means you're at risk for developing trigger finger, or you're at risk for developing a stiff hand. So talk to your therapist and ask them questions about what you can do to avoid having these problems. Talk to them about what you can do to rehab and fix them, exercise, or move them in very specific ways to help you avoid these problems. So that's still my favorite exercise. And my second one is actually to stretch your fingers straight. I always like all my patients, I check to make sure that their knuckles are nice and soft. If they're nice and soft, that means that your fingers can move. You're looking for wrinkles on the back of your fingers as well, because that usually is a sign that you can move. If you don't have them, you need to get them. So that's number two. A stiff hand is probably one of the worst ones. And you want to try to avoid having surgery to your fingers where you never even had an injury. So after a distal radius fractures, it's like the number one thing I do to ensure that the fingers start moving first and they start moving fast because you didn't injure them. They feel painful as a secondary problem to the wrist, but you want to avoid needing something else for them just because you injured your wrist. All right. So that's number two, and it's really huge. Number three, one of the biggest problems I see after a wrist fracture is actually shoulder problems. And one of the biggest reasons why people develop shoulder pain, shoulder stiffness after a wrist fracture is when you cannot turn your palm up and down, your body is really smart and it starts to compensate. So check out your arm if you don't think I'm telling the truth. But I've been doing this for over 20 years, and this is a pattern I've seen every single time. If you cannot turn your palm up, you will move your arm, your elbow into your body. And when you cannot turn your palm down very well, your arm will wing out. Now, I'm exaggerating to show you what people do. I see this from that big exaggerated pattern to very small, minute. You have to look for detail. And when people cannot turn their palm up and down, it's called supination and pronation, they start to develop shoulder issues. So, one of the things that I like to do in my clinic when I'm working with my patients is I like to get ahead of that problem. I like to get ahead of that problem so that you don't develop other problems because you poor thing fell and broke your wrist. All right. So, one of the biggest things that I like to do when I exercise, I don't have a towel to demonstrate, but I like to fold up a hand towel, right? Not your bath towels, not your big bath towels or wash towels, but the hand towels. You fold it up and you put it right here. Now you can also use your hand too, but sometimes it's not as effective as if you had that towel. And when you do the exercise to turn your palm up and down, you have that towel there. Because if you push in, you're gonna feel that towel. And if you turn your palm down and your towel drops, that means you're compensating with your shoulder. If you can get ahead of these three major problems after a wrist fracture, you're going to recover better, faster, with less complication of needing a secondary surgery, injection, pills for pain. Um, People ask me, like, is it possible to have full recovery? And depends on your fracture, but majority of the time, 80% of the time, the answer is yes. You can have really great results after having a fracture, having surgery, and not have any residual problems afterwards. But one way to get ahead of that is to make sure that you're talking to your therapist and getting ahead of these three major problems, after a wrist injury. If you're someone who's suffered from a wrist injury and you're in Miami, Florida, I can help you. My name is Huang. I have a clinic here. It's called Hands On Therapy Services. Myself and my team can help you. I'll include the link down below if you have questions and you want to book a discovery visit with us. If you are watching this and you don't live here in Miami, one of the biggest things I encourage you to look for a certified hand therapist, look for an occupational therapist who has experience in working with these type of wrist injuries and getting ahead of these problems so that they could help you get the best possible recovery. All right. If you have any questions, if this video has helped you, definitely, leave me a comment, click the like button, let me know. All right. Thanks so much for watching. Bye.